what we saw was ministries now being reduced to cooking centers. Can you imagine a ministry now undertaking cooking directly as if it was the responsibility of a minister for gender and children or a minister for Zongo affairs to set up a wache or a kinky or rice factory at the castle? You can go and visit the castle. Some of the lost cooking pots are still around the Osu Castle there. This is what Nana Dankwa reduced it to. Even if you spend 2 million Ghana cedis a day, Papaya standard, you should know what a vulnerable Ghanaian must be deserving of in terms of a dignified, honorable meal, and not that insulting package of food that was given out in respect of 2 million Ghana cedis. You further additionally said you needed 280 million Ghana cedis for that purpose. So shorten the period, multiply 2 million by the number of days of the lockdown, and we demand accountability for the rest of the money. No wonder we are hearing reports that PPEs are now being stolen. Who gives what to who, at what time, and who is accountable? We will not hesitate in demanding an audit into all expenditure related to COVID-19, whether the money came from internal sources or from the World Bank, IMF sources. Couldn't we have locked down much more earlier as a country, knowing the threat? Couldn't we have closed our borders much more earlier? Couldn't we have started massive public education in local languages? Couldn't we have developed our own humanitarian response plan earlier as a country if the president's approach in dealing with this threat was one which was national in character and national in form in dealing with it? We should have had a comprehensive strategic plan in place earlier, a document we have requested without success, making us wonder if there was one. We lost the opportunity to do all this and many more because President Nana Dankwa, in our view, did not prioritize combating this virus as his #1 concern. Many professionals have observed that the data being published by the Ghana Health Service does not lend itself to meaningful analysis in the form it is presented. I mean, any of you who watches Euronews or Sky, even if you listen to the British health minister or holding forth prime minister in their brief, you can compare and make analysis out of the data made available than what is done in Ghana. What you are just told is 3,000 cases, recoveries, and deaths. That is not sufficient for any thorough health analysis. We need to know how many persons are affected, and for our view as a minority, testing, tracing, monitoring, and isolation should have been the order of the day from day one. The focus of this administration should have been on testing, monitoring, and where it is necessary, isolation. And therefore, we are disappointed at government's response to this matter.
Yasaba Bag, the Minister of Information, Oppon Nkrumah, as a short notice again, or a busy schedule today, but Wajibre Seone Bidinko. Minister, that's Wajibre near Kasabat. Quickly, I'll start with the minority and Sana Yabang Semba community, no Wajibre now, Diako. They couldn't we? What is going to be your response? Because couldn't we have, and 4 specific areas, necessarily care about the Muntem, let's see 2 and a mobile suntem, necessarily in Tem San, your money, your Mobusano. Why didn't you do that?
Governor made us in a mamintia, were for ne, one so a fan or radio, a whole draw so a baby, if it even so. Yen your nom command, they say so much as a seminar about no more by politics. Now, or much as to say, and yes, and common now, money about bedin, a sebe or matomo ashe, the air course one casana, sacking kind crata or honor. Or mote TB were around, sending conform, can be near, they are no market can boom their barber press conference. Press conference no so no one suggested idea for phobia. Also, couldn't we have closed our borders earlier? WHO declared pandemic March 11th. Ghana imposed restrictions, first travel advisories on March 15th. And this also couldn't we have closed our borders earlier? A date by. Ubisa question say couldn't we have closed our borders earlier? A date by. Because sad I said nka wo ka say okay nka close no 12th ta Miss Meka say na ne ade na 9th no when close omun kan hwe sa common he so we Ghana response program enra and then me video ndi ababonte enra World Health Organization a video conference. Many Dr. Okubo and represented Ghana. Omo Ghana baso. For Konya Ghana man penny ni Ghana by ni Ghana man yinara. Ya source response program we mu. Omampeni abrebi obekasa an ochre Ghana response program ejina na poso enum so me no wadi nkomo akada ti se minority kasa ono onte ya echre opefe se nkomo aye di niema ekoso ne ade no omo pay attention eye politics propaganda na se o ma se ombeti esim ababaye but meka no keto bi se yeni wo adwuma na ye no eso senia ye be make sure se yare ni bi mfi ama no ne mbeka ho senia be make sure se dia eba ha no ye be contain say or say there was nka aban ye tracing testing and
monitoring and isolation
wati da ben ye start kan contact tracing ho asema sa bre ne kan nkofo se oye ntumi nya wa se a enne afi no musua bi wo ama no ne o mampania kan say ye strategy you so TTIT testing tracing testing isolation and treatment. It is a 1 month down the line. We press conference. It was a strategy. You use here testing, monitoring, and where necessary isolation. Not just even detail. No, I won't can ye. For no one who say tracing, testing, isolation, treatment. And I can't baby some pempen. So we say. But say we Yura Mahama, we Omo Party General Secretary Johnson. I see don't get here. Omo wepo say omo nyesa anema we are obvious. Some people they assembly politics, but yeah, because what I say, assembly politics.
Okay, so
focus
the political bit, but they are raising very important questions. I also say they've not paid attention to detail. Yes. Okay, per this explanation, probably they've not paid attention.
They haven't.
But Omar raised another issue.
To say
the normal Ghanaian average Adriana SOD, who compare, so she can put in a model question 2 million. Now we Adriana Ghana for
another example says to won't pay attention. I mean, Auditor General, Yapamano. Auditor General in the office negu. When any more Ghana has it, and then parliamentarian worth is sort, no any more Ghana has it, say, ministry, department, agency, be a counter away. A Juma away and Nisika was spending. Every quarter, you will internal audit, you will external auditors if you auditor general. You be publish it, a whole expenditure in Nara in the annual expenditure reports. Now, so be more sama will be someone in him. It is a project, because as I said, a Black Stars General Baby, I started tournament airborne. Now, Ubejina in the middle of the tournament say, also more accounting for also. By all means, we are they are not paying attention. Adi aye no cry yen nti yenya ni mebu akuntana. Adi aye no cry no any dim yen wie ye call parliament ko ka say ye $100 million for the initial preparation program. And no on press conference, say there's no preparation program. Or preparation program there. Meanwhile, Finance Minister about Parliament, ebe chire mu ma mo boa he ma yeto so aba pay $100 million for preparation program. And yes, about Parliament say here 1.2 billion for coronavirus alleviation package. It be nemu 600 million. Ye dey bear soft loans for small scale
because coming about COVID and loans and matters arising.
Matters.
You can't put in a more
meba, but ya ba Parliament. The details na beto abe requested. And so now we no fi wa yes I call IMF akoje 1 billion. Abe show up no eno so yesan ba parliament be training am nti se oba na be ka se yemu akunta wa bra onim se apart from ye ba parliament first no ye wi adwuma ko na auditor general be audit annual expenditures are be publishing ye be publishing nyinara eno am some the public debt report for 2019 e bai unim nyinara na be press conference yemu akunta na say we pay attention to kwan fa so bu akunta.
Okay, what is another good point? So as it stands, your debt situation is saying
I will say you check it, the reports and the buy. But 2019 end of year results no the bar cabinet.
Inclusive is bauxite, those
are not debt items. They are liabilities, but they are not part of your cash debt stock because unko bo business. Why a batter? Yeah, but once we get into that report, you're going to do that. But just to wrap up on the minority there, and no man can be before from here. That na ya na mahama kana no machichire no kakra no mode propaganda kakra ka on ya beto abontin ye focused on ade aye ya say nyame adom ya clear backlog ni na fiti say endefi ada ekon ye expect say on a daily basis no betimi my new numbers of actual ones are eba labs ne mu ni ade ya buy nim
but me ni say dom kuma na be ba be din koma I buy into some of their fears and
say,
allegations.
Say,
even your COVID situation, the belief is that really the picture that is being painted?
What justifies a belief other than that? Okay? Ghana Health, India. Ghana Health Service, Professor for Noguchi for BBC for Crimes and Nose and then some be sing called Noguchi, Ekoye Mwajuma. Obia Sebi wa quadre wo epidemiology mu infectious diseases mu ni ade ehwe data kura ye de babontin website ayaye map kura da ho aye kire o say aha otiase clearly say ampa Ghana mpanimfo na aye handle wo yi politician for ni film technocrat na aye handle adwuma no omo te adwuma na se enra omo be publish omo epidemic graph ekire die nti a omo ka se omo susu se 25th of April enana the most dangerous day mine because Sadana unya the single largest number of positives samples that were taken. If you want unya daba kwa when such a large number. Inti omususu se wo plot here no as a curve there ya ba form. I will see so a form na ya ba no emu a. Sa nimdie ya mpanimfo kire nyina. Ebi mo kata o mani esi o maso se yenti ye be politics, ye be propaganda. We are say so we had data now or more publishing now. Afiti or say utie UK Prime Minister press conference. Now utie him from press conference data
no more provided data.
And then data no more provided I am provided her. On more bako. Who can decide say tra bobako then data no more provided.
But he was emphatic. Mubejina almost the number of this 3,000 the number of recoveries. But breaking it down for you know.
To said then break down ben na e was say the buy MFMI. Break down ben. Break down be anywhere say be akechira MFMI. Who they compare for website by website. Am I man in our website? Now for compare the Ghana Health Service for you. Missy way say politics no more ye. Ye can ya say empesi be do ha say. Because you do ha na. Afi say mini penny haruna kasa say. Now say me respond you. You na me ma futu na about share mask near ya. Mini NDC ni bitu because o minti wakase tia me party.
Especially when they have said that
even empesi be do ha.
But the point is that ordinarily or catch Ghana for say bere kwa na ye wo be aduasa ye wo aduana ye wo aduonum kra no mampanyi de hwehwe bi gu akwan mu eni mo be catch ye say ye nyina ye embrace yourself up say emu de be den e be pija na e be sa esifom eti ono so argument ni say ye wo ketu mu mpo no ye kan ye hye dem ye pija bo mu no so no abansi wate ye simonte
wa kire en say de aye nyina still omo pay attention and pay say wo hwe other international news networks are. Amani be 173,000 in terms of case count, but omo peja in anymore. Austria, Germany, even UK cry by weekend day. Ombe start here. Yo yenya propaganda na yensuya de kakra. Omo nyina omo numbers in terms of case count e wo soro. Adenti na omo bie. Ya kan say one lockdown no mampani e lock it down on Krani Kumansen. One kan da say ni yenya case do ntina all lock it down. O kana sa anka unya du ba ko ana du mienu dia e be stand to reason say eh ene we say but ye nua no mendisi for o kan bibia o mu pay attention po ana o ma tie reason no o ma mpanin kire mu ya kan say lockdown no hwe abrofo no numbers na ohu no if general surveillance ase kire say o mo te hospital ene ye say o hu dodo a bra na en testo kwasi bro ni ka kire say wanya 1000 na kire say nipa 1000 ena yare aba hospital ye nimdiefo ayi no mo tenase no mo say wo ye ne saa by the time 1,000 be ba hospital no na wo be 4,000 wo fia o mo hu fia se endodo wo mo so more ni bi wo mo inti Ghana ye adopt a different strategy friend enhanced tracing and testing ti ye fia se ko fie mu saa bre no no man pene say lock it down na ye nya 2 weeks bi no mo ko fie mu saa time na hwe ni pa 10,000 say ya testing over 13,000 omun ko fie mu ni enhwehwe nkofo yesusu se obi benya bia at risk population omun no benya ne kane ye test safo ni na area na ye hu ye baseline infection rate na ye less than 2% and na me no ka say less than 2% o man penisi okay enti eno de a ye de niam miensa begu akwam bako ye borders ya tutu ye borders nyina mu America English approach mem aman bebre still omun tutu on borders ye ya to ye dim etoso mienu ose ode tabona to niema emankofo hyiehia bebre mu school sorry masalachi nhyiemu akese ne ade ode tabona toto ni na so into infection rate no kofom the toso me ensa ye promote the friend no personal preventive etiquette me buy is first na me buy enkonya me no bi si ase no na ya se hwe ba wi out se be me kasa na se ntesiocrafi menuma ento so owie kra no se obia enhye mask me buy ebi no wa se ninja ya out we me so my se ninja ya emetie ye hye mask eniema we nyina ye di ago emu a ye boy ho ban na covid-19 no so when sua bibi wo ma se usua the history of pandemics Spanish flu ne nkeka ho a e tell say pandemic no e ba emienu baako eye yare na nkasa ahokyere a ede brew baako ye se udi agora na se wamfa sebe abode mu nyansa panim die anso ano a obewie no wagu the whole economy obi anko obi amma obi nsa anko na no ekom ni ade so na eno krampo ne ba be kunipa nti e balance ni say o allow as much freedom as is necessary no we impose as much restrictions as are required nti that balancing act we are seeing nara nya musuye hu eno mampani ado danko akufo ado okan wo ma ifi ase de ye hu adwuma do mandatory quarantine a ye wo Ghana edi ni 1030 good dem e testi wom esen keep wom testi wom prenu amaya hina
meba
ayebi meba amaya hina ayebi utan okwadu a no we yi ni mrika adwuma mampani ne ni mpanimfo eye no esomobo ye politics no ne nyina ye moa no ne support no
well ye be yi sa a tiny so called nephew on no minority still a challenge but I mean coach what they are saying I say the minority demand for a new policy approach based on science is born out of need to preserve human lives and protect our health system. Ghana's case count is now amongst the most infected countries in Africa. And somebody was sanity.
It's a new policy approach.
This has a frightening issue amongst us. He could also say, it is absolutely troubling and shocking that in the face of such a pandemic, our government chooses to supply PPEs to officials of Electoral Commission when doctors, nurses, and other frontline healthcare workers are crying for PPEs.
You can say you produce PPEs in Ghana. You distribution ne kosoro. Wa unye bi kura fre 311 into me connect na you provide ubi no. I say still Electoral Commission who politics no more here. Kwabra we nkomo we dia M1. Mesre say you focus on
that is a whole minority.
Oh, jai. Obi say obi ate ase say politics e na omo ye. Ntu ni bibi. Yem fe no ntu nche. Na yem focus on progress you make as on mind on COVID-19. Obi tifie opeso tie real information about crime ben also between fast.
Amongst the information is what they have raised. The minority urges government to ensure a high level of accountability.
Na and I catch say sabrewe o kan sa
in relation to COVID funds, they are raising that issue.
Na one aka say auditor general Juma no wajai. Na me kasa o kasa say Juma e Nkrumah o ntia say. Auditor general no waka say Juma no wajai. Auditor general be audit. Ye krampo ye can right from the beginning say remember kan okobo e ka obi ya kan say every single cedi I spending no omo wi a omo be audit. Nti wo be press conference say omo nya accountable as a processes are ye fa so e dey adwuma Ghana ha no wontia say na me ka say komo we moae ye mfentu nkyere anopei obi pe akwankyere e wo mask ne pam ne hye ne use ho obi pe akwankyere say me madwumani kwan be na metumi afa so abie obi pe akwankyere say me manu school kwan be na me fa so akọ minority for ko fa sa enema we betuma
Is it that you want to just say omunim di omokana say you don't want to pay attention?
Politics.
Because when they say the president took a terrible gamble with our lives when he lifted the lockdown, at a time our case count was increasing. Don't forget that almost rapid response team with COVID-related matters are almost advising the minority.
Sir, on political team, no. Parliamentary candidate for Isika Duketan or a medical doctor. Oba osi onye politics no ye no ye ono ba o se bonso fele program o be kasa ya mo amobisa ne se o ma one new idea o se ne new idea ne se aban na starting ne mantem men kai ne din Dr. Grace sa politics no mo ye kwabana emwa me srew yes me srew politics me pese me focus o me pese e focus on ma me no tifi na ohun se ne ba be ko school na on ko school no be ko school mpo a den na ban make sure say
Okay, so around that area, no, but it was very important for us to also listen to the side of the minority. Now, buying for that response, and now what you mean more na area and say the probability say you be school as I share and sorry as I juma am a bibia theater high and I say you share him say an extension.
Omampeni efiase ye engagement with ekuwa hodo asofo imam for school for ompeni for ene niaka say dedi kan enye no kreda say afebo ye de tabono betoto saa niema we nyina so ebedum pempenso bi a ye bebie ekwan be na ebetumi afa so bia obi nkonkonya yare ni bi ewo ho ewo say aban ni provide mask ema obi ana say ankura ni nyuma nko ni te say sorry ni masarachi ni ade o man kasa betumi provide o mask say wo say spray ni spray ho a abreben ni be spray ho ho na be fa ho ka say wo say social distancing be mu a kwan be na be fa so ne aye wo call ye dwam public transport so a so betumi aka say yenya social distancing ni mo obi an share mask ana obeka say while obi a share mask no still yen sanye social distancing say GPIT for ne trot for ne for catch say me trip bi a cost me 2 million na me fa nipa eduno na so me fa nipa du ba cost na 2 million still na say me boka wo so masen ana so be den no ni nkomo a enra enne memenda kwasi Adom Mpensenpensenmu ne asoafo nyina yetefa akwa in a retreat a ye hwe sa data ni na nsa central adwuma sei ehu sika sema bofom sanse revenues no emma sanse adwuma generally akofom nanso at the same time the central adwuma no mu na ye pigam because of round the clock broadcaster nti central adwuma ko bibiri boka omde omkrata abremia me kwa ko defend say eno nti no emmoa ye fiase de aba no kwan ben ni benya bi de aboa central adwuma fo eno ne adwuma Omampeni na pamfo esi nkonwa fiti anope no nkono yes na to
but already we are challenged by sika 722 here because almost every sector atela for also the brain so almost adwuma ho asem o hwe obeko additional for titiri hotel for almost so adwuma ho asem aba for are we able to combine all these people and give them a package? Is that possible?
Enontina potokasem yes you deal with a complex global problem. Enye local problem will be a created abon on one gazan to mean solve because nipa no doso enyuma kuo no doso nti ekwan be na abefa so abetumi abo bi
private teachers for so market you want
economics mo no you be a friend of fiscal expansion I see etumi biem na ye de sika wura economy ne mo back ye wo akwan hodo a ye fa so ye bi ho a one ubema banks no ube lower or reserve ratio any ratio say was banks no equipo no manya sika ne bi de abobesia ano emre amanipa dodo bi ho a obema Bank of Ghana nankasa act ne policy lending rate no so ono te ne policy lending rate no so na benchmark ma bank bia so bet ne rate so nti obi a nanka first no okobo besia no ne bo wo soro no and obetumi anya no wa bra e wo form kakra ebi wo ho a obehye da pesika e de ewura banks ni mu they said they are 600 million Ghana cedis as a first step I di wura banks manu for businesses are e wo ase to say tailor for ne nkeka no ade business we obi a wo sa businesses ni bi use bank bi utia oto ma ban ne ade asa abre omo wie nhihye na se omo bi mu a usu bi eno de aye de wo ho ne se afe ba ko a edikan na bosia no ntua 1 year moratorium emfie mienu because 1 year na wo dey recover emfie mienu to aso no na ade betua bosia no so no the rate that so no ye dey abafom papa on be announce rate ne dey abafom papa na nko yet say normal commercial lending uye no fi ho a aban ne bank for no so aye
adwuma no fi ho no mayem hihye ordinarily they say Gia ni yejiji busia kesi fifiri amansu ni nkwa
600 we enya busia
yankasi sika
ye Ghana sika if 1.2 billion nimu a ye call parliament call discuss ma parliament to aba e de man enu ntina se minority betena ho say omo nya aware of their e koso a e wonwa no sa 600 no omo to aba e ma 600 no parliament enu na ye de ama NBSSI ni banks no nti bank ne de be ma o say e busia because ye wi a o say this is kan kokoto bia ye kofa fee but the ye kan say afi ba ko edi kan ne de wuntua mienu eto aso no na wetua rate no so ye de above because ye yan sika da wa ye defa banks mu dia ma se na banks no betumi agiska no e de ababa na meka se uye no fi ho a mampanin so san kire se ya san ne banks ne bi so adi nkomo a omo so ekeka omo sa se apebe 3 billion for enyuma na e yakese kakra no tite se hotels no any other industries are so a omo so badly hit no te say mame fa central adwuma nye example sabri se sika na nka bosomi bia munya esu ehwan be ye fa na se still wadwuma fo nyina so eye adwuma agi aketua na che se obehia sika bi asemmoa but economy no en recover yet inti se nka yebenya soft loan bi out of 3 billion yi say ye the amount na emo bosomi nsia na feso mentua economy no pick up na afi advert eba back ne ade no ne de nsia egu akwam na afi wafi ase atua enkebeboa sa complex structure ntinye bosia na ye kwa akobod kekede aba beto ho sa keke but insise ya hodo na yetumi enya sika e de aso nipa dodo ase no ni complex issues are mampani say why focused on ntinye ye kase o ma ayere o mo so pese o mo distracting no na o mo de niema sebe ni nyina so bia be wuram no
ebia actually wona adwene actually bi so chire ma adwene actually ahwefo de bi so adwene nti yebusa no akọ ya aban kasama fon de ahobrase mu se be sele na wabo yi ano be na ene mi ye wo fo me gusu odwene wo kwa me fo so ameba nenim de enkofom obetimi akosuku me ye asori ko ni me ye kremusum ni me pe akwanya menya metimi ne madofo ne mapamfo timi hia me asom ye nyame ahodo ayesom no saa hyehye e hayem titiri ya adesua wo hyehye adesua wo hyehye no obetimi akasi so dua se enche bia ye bebie kwan ato ho ama ye mofra ne adofo ne yadehye no etime nya sa akonya kosua de
ma menkyere mienu edi kan sabri ya ofa na te se basic schools nanka eba bebie sabri yentumi mfa ye sense ye bo se ye bebie basic school because ye bie na oba no kono kofa yare sebe ebeda ne bonkum so ofia ya haw enti na wo se aban ye boa wo na wo bo oba no ho ban by ensuring sabri schools ni ye mie. But Ghana Education Service, any Ministry of Education, my timetable, I publish it. Meaning say multimedia, mo krampo mo channels na ba koka ho. Omo eba beboa ma yenkwala no TV ni radio so, any one mo ebenya abefo ntintan. Omo tumi esua de mpo wa bra omo wo fie no. Any first step. Second step, enra say, ora Matthew Opoku Prempe presente paper to cabinet ekwan a ebetumi afa so ebie schools amankwala na ko school back na se ye be na saa enieme wo se ye wo school ho ebi na make cha say so obema kwala bia mask na so obe spray school ho be ye na wotwe bia na teacher fo no obe ye omden no so abo omho ban kwala ne ntam tete wa ye hu nyina nkrata de aba cabinet a eno na make cha say be ye fiti eno akopim kwasi ada no ye free assessing who sika ni ade nyina because ni na sika sem assessing who sika nyina na afi yetumi take those decisions no nti awofo enya abotoyem se akwala no adesua no ye mpese betosin entosin ye de TV radio efiase na yetumi ye nhihye ni wie kopem time ye bi schools no pe yetumi so ahwe na ye bi schools no
well ade ba ko so kwadwo eba apa nipa dodo na so ye ne se enei yesusu se we nyina aban dwene ho aban fa ha aban si ha aban ro ha no sei Ghana for dodo na nso adwuma eba tiana etiba form awode ne kwa ana ekofom ayem hihye no so kwa na ekosto ban bere wetima hare no ho ama isika sem ntotoye ene enyuma hodo a ehwehwese form as a result of the time you find yourself etima kenya ho because dodo na esu sisi
ntina de bia ye kasa ye se e wo se ma nimdie no edi anim balance so ina make us study the history of pandemics so wo kasa what will be upon bosomi miensa bosomi nsia udi agokra wa ne komkra be kunkofo ofie but two nipa akone aba meko to ade we okroma beton meko ye we abeton eno na ma economy no ekosoro ma obinya ne bibi kakra edi nti as much as possible na wo say wo balance kwan be na betumi afa so abi ma nipa edi akone aba nya adwuma ye na at the same time no so no wabo nipa no ho ban te bi no mampani say one say wo to borders no mu ade efia yare efia ma no ne ba no ebi mameka ho two sabre ya nanka yenhye dan hu anu ye de tabona tutu ne ma bebre so eno kra na maka che say ye consider kwan betumi afa so eyi saa tabro na fi ho manipa aye adwuma kwa aba but obebọ ne ho ban bambo no ebi ne the friend of preventive etiquette ahodo se say ubeba multimedia say na nsuo ne seminars ha say sanitizers ne ade and tip through the boy ho ban ba ko papa eye mask nti eno so wa hwe ya hye ho mra and say so oba nkran na so wura central business district na won hye mask a police for ne ade gina ho a omo ye education na ye pamo so ye ma wura ho other municipalities so efiase aye the same thing at the same time so you produce masks ni bi ache amankofo for free e de aboa and then as I say me come district you produce be 10,000 masks ye man ya bobo ma no
no ya buy an individual
and say as MP and me name DC ye Coastal Development Authority omo ye be 70,000 masks acheche ye say o Iribi secondary school ye man no egu ho ma ye social distance fine omo pam mask na de a combination who provide be who enforce it your education so that in the end ubetumi ebie mankofo ye adwuma but ubebo omoso ho ban obi anka say yare ni nti no makadem edi here a balance.
Okay, so again aban consider Ghana for dodo no ana binimu a wona koka kwantuo mu a omoso edi adesede to aban nim say on consider omofie ba because omo ahoyeyem omo pese omo be wo omo ko
aba cabinet ni mbe prensa so far but assessment a doctor for ne epidemiologist ne virologist ne ade ye no sabri maya kwanya ma yentumi nie borders no because assessment ni say whilst ade na pandemic still atese wo wiase afana nyina no uko bie so wo beka so obi an test ansa na wabagana na uni testing certificate
specifics if you kura confirm that to suggest that then into presidential jet Nkron crowd Ghana
presidential jet na efa nipa 11 enye feasible suggestion entumi nkokuru bia nkonkofa obi ama
that's a suggestion
na say I mean as for suggestion dey come obi atumi a suggestion but point in say I was say we be borders na utumi eye assessment bi nhihye bi so ubeka so obi a obia on test no fa ne test certificate nche wansa na aba na say ho na abefa is that to say ube check is our testing labs ni nyina o man bi o say o testing ube kono RDT testing or antibodies enye PCR ni bi e be kire o so ampa nipa no yes oni bi enti na che say o ka say akwan na obefa so a e o say sa labs ahodo from all the other countries are flights we ho banyina no o send obi call man ko calibrate ma o sure say we results e ba metumi agi atom ana eno wo nsunsanso so ubeka say obi amra na yenye mandatory quarantine na yen test obi a because yen testing na yegidia na uka say obeye ne saa Ghana has say na daba ko nipa 7,000 and eba in a week say o calculate a year almost jamabe 50,000 or so na eba so ubenya baby di nipa be 50,000 na what bia egu a sanitary conditions bibia ye normal nipa 1,030 equal na science student for ma omo sebe chere se omo kwa no da hotel no omo chere se baby ana omo da no mani ni hu ni enti complex
conversation me kwa na ko by seven so dos here but quickly answer the probably 1-2 questions about constituency no almighty 88 hospitals in 9 regional no mashen ko na se da be na mo dey aso bofom
o se no na e ka so mampani dey chef finance health and infrastructure committees of cabinet nsa o ma ye ho meetings ahodo be 9 afiase ekuche ni eho ka ni ade nyina minim se omadwuma no omonye ye crap by now de emu be ye fan de omaye sa abere we say ba se no mampani kan na wo se omoba cabinet e be presentation na aban no je opinion so okay nti we no kwan a mo se emfa sika no emfa no anu ni titru program na temi o model a ye di besi e 10 key project ana aban na e ma ni sika se onko si dining si ho no we are mo bi sika se onko pe equipment ngum no we dey Ghana health service na sa models ni na no on ba beje ehun tumi krata on gi wi a no ma be bode wuro e ma ye nyina ya te se ampa but me sure sa kire so by the time I call parliament for media review ni there clarity no e be ba bontin
komna pa to bu sa kojo Oppon Nkrumah ma me say GN savings and loan customers so kanipa e be tuwe waka no ho ana
menim say e can be do savings and loans companies no I just said there be a specific challenge be ho.
Okay, lots of your questions but I mean to me constituency to say
boko em say and then ansan ye call ho say na make no ye masks ho adwuma me ne honorable Paul Asamoah or DC to produce about 10,000 masks now. Already I sanitizers, buckets, a lot of public education so on the ground. And some of kwan and kasa no so no contractor also are all year juma.
That was issue can be reason because only about a kwan on once.
Oh, obia or ye hobia de. Nani to as a contractor or kwan so year juma. Nti me ankasa so na say me cover some parts of a juma now all year bridges I can see between a yiribi any phone say all year ho juma diversion why na anadwo se ne create challenges kakra man kofo nti adwuma gusum kakra
so ko continue but region must say there are a lot of issues popping up
say politics there politics there baby no issues back me no be pop but the management no ne here
okay so honorable minister understand some of the constituents okay so Osha kojo Oppon Nkrumah Osha kwan na kwan nye papa
I know that yeah.
Osha kwan na be say otias wa Osha ofie no e kwan no enu ni Mr. Kwame Nkrumah
we fiti ayiribi ekofo ase contractor for eguso omo ye bridge na ewo ho no cause nsuo bi dem no na nem say diversion no ma ye na ye kakra nti ye kohwe ye ko tu omfo kakra kwan ya ombetumi afaso
there seems to be confusion in this region in relation to elections parliamentary elections
oh there be ogide wo chairman kisi ne na pam for mu say omo be resolve all of those issues no
okay mamedase and thank you for effort all this from Ghana any ebusia for
yeah da mo so asese munya bre ma ye ko into issues ebe ma Ghana tumpo
but before I show you know cabinet in consider the biggest of all the proposals which is media houses ahodo nyina no ene ye kwa hoyehiem na MA take certain decisions M1 department do na consider that on your table for us and then a special birthday dedication come white man kwaku usu happy birthday so Koku Obiaje sorry
media assistant and any birthday I wish you a happy birthday
Koku Obiaje happy birthday and about Koku so
how many day back waka o
the man say go join training your bat is there be sia ya sa 20 birthday so ya kwawa